Hey guys,
Hello!
it's Tuesday,
It is.
and Addie's coming at us again with another update. I think this will be part 2 out of 3 for
I think so.
her very fancy heart rhythms code that she's been working on.
Yeah. We'll see how long it takes, but. So I just wanted to go through more of the rhythms and show how they would look just with two LEDs, and go from there. So last week we did the, call it? The atrial rhythms, the ones that were started from the top. These are the ventricular rhythms. So maybe I should show you guys what a normal rhythm should look like. Let's see, where's sinus rhythm? Run, compile current, load RAM. Okay, so this is what a normal rhythm should look like. Very nice filling of the ventricles and the atrium, good pumping, etc.
Can you remind people what the amber and the blue LEDs represent?
Sure. So the amber light is pretty much the start of the atrial conduction, electrical conduction at the sinoatrial node, and then the blue one is the start of the electrical conduction at the atrioventricular node.
Okay.
Yep. Okay, so this is normal. And let's go to VFib.
These are very precisely timed, by the way. That's her major step forward with this code is ability to time things very precisely.
Right. So this guy's eyes are probably rolling back in his head currently, and we're probably on his chest pumping like CPR. And this is a shockable rhythm, so that's when you hear the clear and shock.
And this is what Addie does at her day job, so she knows this
Well,
stuff.
we try not to. We try not to.
Well, I
Get
don't
people
mean
into
jumping
that.
on people's chest if you can help it. I just meant the heart stuff.
Right. And then this is ventricular tachycardia, and there you
Eh,
see, yeah, you see, there's no atrial activity. There's only ventricular activity on the ECG, and it goes like at least 200 beats per minute, or like at least 150 to 200 beats per minute. And we're usually pretty much running into the room and also jumping on the chest. But sometimes some patients actually have this and they can't feel a thing. So good on them, but they usually get a defibrillator then. And this is sinus rhythm with first degree block. And essentially, what it does is it takes longer for the electrical impulses to go from the sinoatrial node to the atrioventricular node. So there's two of them. The sinoatrial node sends electrical impulses that control the heart's rhythm as well as contracts the atrium. The atrioventricular node is what sends that impulse down to the ventricles, which contracts the ventricles. Anyway, so the first degree atrioventricular block just means that it takes longer for the sinoatrial node to send its message to the atrioventricular node. This is second degree type 1, and you have to actually take a look at this closer. So what happens is the PR interval, the time between the sinoatrial node and the atrioventricular node, gets longer and longer and longer, and then there's a dropped ventricular beat. So closer, longer, longer, dropped. Closer, longer, longer, drop. You see that?
mm-hmm.
Yep. And then this is second degree type 2. And that first one was known as Wenke block. But the second degree type 2, this one is somewhat similar, but there's no lengthening between the time of conduction between the sinoatrial node and the atrioventricular. So what you see here is just, let me see if I can start from the beginning. Okay. PR, PR, PR. That's it. Or not PR, but you get what I mean. Right. Atrium. Let's start again. Atrium, atrium ventricular, atrial ventricular, atrial. Atrial ventricular. Now the problem with this one is for some reason there's a block between those two pathways, and so you don't know when that patient is going to completely block to where nothing from the atrium come and the ventricles are just it's because they don't get any impetus, they don't start, they don't do anything. So usually patients with this get a pacemaker. And then third degree, and this is when the atrium go at their own beat and the ventricles go at their own beat. So the atrium have this intrinsic rate of 60 to 100, and the ventricles have an intrinsic rate of 20 to 40. So if you can imagine, normally your heart would be going between 60 and 100 beats per minute, but because of third degree block, your ventricles may be going at like 30 beats per minute, which means you're probably feeling pretty crappy. Right, Whisker?
Mm-hmm.
Yes. Okay, so then I added just a couple of extra ones. Sinus with a bundle branch block. And so kind of like how in sinus first degree block, there is a delay between the sinoatrial node and the atrioventricular node. Here we have a block in the bundle branches, which are the electrical conduction pathways that feed the ventricles. And so this could be due to scar tissue, could be whatever. For some reason, the electrical impulses are taking a longer time to get through the ventricles. And it's usually not a big deal. So, yeah. And the last one, junctional. This is where there's no atrial activity, essentially. I shouldn't say that, but it's more like the start of the electrical impulse is at the atrioventricular node. That junctional node has an intrinsic rate of 40 to 60. So the sinoatrial node has an intrinsic rate of 60 to 100. The atrioventricular node has an intrinsic rate of 40 to 60. And the ventricles, like I mentioned before with third degree heart block, has an intrinsic rate of 20 to 40. It's really cool. It's just like backup systems for the computer people. Your heart has like 3 to 4 backup systems.
So, all you guys out there, you can see that Eddie's doing like some practical applications with spin code here. She's actually, putting together some educational, tool stuff for heart rhythms just by using a couple LEDs and propeller. Yeah. If you would like to learn more about how you can learn how to program these things, Addie is very kindly sharing her learning experience with a weekly podcast at firstspin.tv.
Correct.
Well, that's it for this Tuesday edition of Toymakers. We'll see you guys on Friday.
Bye.
Bye.
We post videos all the time, so don't forget to subscribe and follow us on Twitter at TYMKRS.